HIV/AIDS is still spreading in the U.S. According to HIV.gov, approximately 1.2 million people in the U.S. have HIV, with about 13% of them not knowing they have it and need testing. With this Monday being National Black HIV/AIDS Awareness Day, thanks to the Ryan White HIV/AIDS program inside the Health Resources and Services Administration, I invited physician and associate administrator Dr. Laura Cheever to talk about why the virus affects Black America the most and some of the causes, plus how current medicine is treating HIV and the future of treatment with testing when it comes to a cure. Good morning, Dr. Cheever, and welcome back to Maryland Perspectives.
Thanks so much for having me.
Now, while infections aren't at the rates they were back in the 80s, the virus is still spreading predominantly in Black communities. Why is that?
Well, I think we saw during COVID, and it's true for a lot of diseases, that there are underlying health disparities that are related to people having less access to medical care. For the African American community, I think it starts with first, people not being aware they have HIV infection. So testing is important. 1 in 8 Americans living with HIV don't know they have it. So people need to get tested, because when you get tested, you can get started on medication, live a productive life, and reduce the risk of transmitting HIV to others. I think the other important issue in African American communities in particular is around HIV stigma. HIV stigma is alive and well today, and for African Americans, particularly gay men, they're dealing with that intersection of living with homophobia, living with racism, and on top of that, HIV stigma. So those compounded can really sometimes result in being sort of too big a barrier for someone to really be able to significantly access care. So I think it's really a combination of those issues. And the good news is that we have the tools we need to end the epidemic in this country, so a lot can be done.
Yeah, it's pretty amazing where we are today as opposed to, say, 20 years ago. So let's talk about those medications. Explain how the virus is suppressed once an HIV diagnosis is given.
Today, with the antiretroviral medication we have available to treat HIV, most people newly diagnosed can be started on one pill once a day with virtually no side effects. So it's not like in the old days where the medications were super complicated. They're not anymore. And if someone takes their medication every day, they can achieve what's called viral suppression. So they are not cured of their HIV. There is no cure yet, but their virus is so suppressed that they can live a long and productive life, and they have effectively no risk of transmitting HIV sexually to someone else. So it really helps us interrupt HIV transmission within communities.
Just to repeat what you just said, with suppression treatment, it makes it possible to not give the virus to a sexual partner, and that is just amazing. It really is. So we're also seeing a disparity in this. Why are the suppression rates so much lower for Black and African Americans compared to others who are going through the same treatment?
Yeah, so I think the reasons we have those low rates is because we do have disparities in access to health care in this country. Right. So the Ryan White HIV/AIDS program where I work was specifically developed to make sure people with HIV had good access to care. So we provide funding for people. We provide services for people that can't afford to get HIV care on their own, and those services include medical care, medications, labs, but also essential support services for people that are living at or below the federal poverty line in order for them to access care well. Things like paying for transportation, helping with emergency housing costs, helping with food, because people that don't have enough food to eat or their electricity is not on can't necessarily prioritize their health care. So our program, by being so comprehensive, really allows people to have much better outcomes. And in fact, among African Americans, 87% of African Americans who come into our program for health care are virally suppressed, which is much higher than the national average of viral suppression, which is about 56%. So people can do really well if they're given the right support they need and culturally appropriate care. They come into a welcoming environment.
So, Dr. Cheever, how does that relate to Maryland? Do you have some information on how people here in Maryland can actually contact your program, learn more about where to get tested?
You can go for information specifically about HIV care and treatment. You can go to our website, which is hab.HRSA.gov. And there's a widget where you can put in your zip code and find providers near you. For getting HIV testing, that is also widely available, and I'd recommend people go to hiv.gov. And at the bottom of that website is, once again, a widget where you can put in your zip code, find where you can get access to HIV testing, as well as self-testing, which means they can send the test to your home, and pre-exposure prophylaxis. So for people that test negative for HIV but are high risk, there are medications available today that can reduce someone's risk significantly acquiring HIV by taking a medication every day or getting a shot every 2 months. So all of those resources are available at hiv.gov.
I'd like to go back and talk a little bit about the stigma that you were referring to for the LGBTQ communities. Is this still a big population who is affected by HIV/AIDS the most, or are we seeing a lot of women also being exposed to the virus?
Yes, so that's a great question. So for African Americans, if we look back to 2019, about 62% of new infections were attributable to men having sex with men, primarily gay or bisexual men. About 31%, though, in African Americans were attributable to heterosexual contact. So particularly in the African American community, black women risk of HIV is about 11 times greater than that for white women. And a lot of that just really has to do in the communities where they live, not particularly increased risk behaviors, but just being in a community where there is a lot of HIV infection. And so if you're going to have sex, you have a much greater chance of acquiring HIV.
I would like to end with talking about a new report that came out. I want to say it was either early this week or last week about using the mRNA technology that was used to make the COVID vaccine to vaccinate against COVID. And now they're talking about using it to vaccinate against HIV. Do you know anything about that medical technology? And do you think it's going to be available in the next 5 years?
Yes, so that is really exciting technology. We have learned some things during the COVID vaccine or had some accelerated development, and certainly mRNA technology has been around for a while, but it was rapidly accelerated with the huge investments that the U.S. government made in vaccine development. So I don't know if that's going to be successful in HIV. I think we're hopeful that it might be, but HIV has turned out to be a very tricky virus. Because of the way that it hides in human cells for many, many years and the way that it mutates so quickly, much more quickly than COVID. So I don't know if that'll be successful or not. I am hopeful that it will.
No, I think we all are. Once again, give us those websites for testing and also to get more information.
So for testing, I would go to hiv.gov and scroll to the bottom where you can put in your zip code, or go to our website, which is hab.HRSA.gov. And there's a widget where you can, once again, put in your zip code to find HIV care and treatment at low or no cost near you.
Dr. Laura Cheever is a physician and associate administrator for the Ryan White HIV programs at the Health Resources and Services Administration. I'll be sure to post those links on our website, 98online.com, for listeners to get more info and also to get tested if they think they need it. Thank you so much for joining me today and for still working towards a cure for HIV/AIDS and advocating for the most vulnerable populations in our country.
Thanks so much.